Make the ask. If you're a business owner, you're in my position, don't be afraid to ask for the sale. I would say the most challenging part of being a business owner is knowing how to sell, because I'm a public health professional. I'm not a salesperson, right? And so that was a challenge, but it's not about knowing how to sell. It's about asking for them to work with you. It's like, hey, we can help you with this. This is my experience. This is my client's results. Ask for the sell, and more people will say yes versus you just assuming that they will say yes because you were present.
Hey friends, welcome to Public Health Careers. I'm Omari Richins, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Brittaney Jenkins, who is a public health practitioner, consultant, and CEO of Jenkins Public Health Consulting. With over 20 years of experience spanning healthcare, public health, and entrepreneurship, Brittaney has led innovative initiatives across chronic disease and injury prevention, program design and delivery, strategic partnerships, and community outreach. She's built a career focused on helping health organizations strengthen their efforts to advance equitable health outcomes and systems level change. She's also a career coach and mentor to people who desire higher pay and fulfilling jobs in health. She conferred a bachelor's degree in public health science and interpersonal relations from Ball State University and is a certified health education specialist and child passenger safety technician. She's also a dedicated mother and wife, volunteering in her local area at women's shelters and adopting families abroad to improve access to clean water and nutritious meals. In today's episode, you'll hear and learn more about why chronic disease. Cut. In today's episode, you'll hear and learn more about why chronic disease prevention is crucial as many health issues are preventable, why mindset is often the biggest barrier to career advancement and how to overcome it, why taking on certifications and on the job training are a key part of skill development, and the misconception of nonprofits not offering stable job opportunities, and so much, much more in this conversation. Be sure to hit that subscribe button and enjoy today's conversation.
Hey, this is Brittaney Jenkins, and I am a public health consultant. And this is public. I messed that all up. Sorry. All right. Hey, this is Brittaney Jenkins, and I am a public health consultant and executive coach. And you are listening to Public Health Careers.
Welcome back, Brittaney.
Thank you for having me again. It's been a while.
It has been a while. It has been a while, but I'm very excited to have you back on and for you to share more about what you're doing and how things have been going.
Yes,
I feel like last time we spoke, I didn't know about the executive coaching part of your role, or maybe you weren't as developed in that. So excited to dive more into that and everything else. And welcome to the
absolutely.
show.
Thank you so much. Yes, life has truly changed a lot since we first had our interview, 2019, I believe. So it's been
Yeah,
a while.
absolutely, absolutely. So jumping into things, how do you identify and tell us a little about your personal background?
Yes, so I identify as she, her. Um, Originally from Indianapolis, Indiana. Living in the Midwest was definitely something I enjoyed, but wanted to get away from the cold. So moved to a few southern states, Tennessee, Alabama, and now living in Phoenix, Arizona as of a couple weeks ago. But I'm also, very passionate about volunteering in my local communities. I love arts and crafts. I love to refurbish wood items and make them new or modernize it. There's a few pieces in our home that I've actually handmade or refurbished. So I love doing that for fun. I'm also a travel junkie. I love to travel to different places like Belize and Mexico and not just go there to relax, but enjoy the food and culture as well.
Well, awesome. Thank you for giving us that wide breadth of your life. Like, what is the thing that you have refurbished that you're most proud of?
The thing I've refurbished that I'm most proud of is I had a dresser from when I was about 5 years old. The old school dressers that were big and built well and deep dressers. And so I was able to refurbish that for my daughter right before she was born. I did it all myself, repainted it, put some new wood to it. And it's still, it's still standing. So probably like, I don't even know, 30 plus years later now, to refurbish an item that she can keep and that looks really nice in her room. So enjoyed that. I used to make clocks and all types of
Okay.
stuff.
That's cool. That's cool. I feel like I don't hear about that enough. But shout out to you for doing that. And I
Yeah.
agree. A lot of the things that are made today aren't really, they don't stand the test of time.
Right. Yeah. So it was pretty cool to bring that back to life for my daughter.
Awesome, awesome. I mean, before we go into your academic pathway, I just want to jump into some of like the expertise that you have in your career and ask some questions
Yes.
around that. So you have a 5-step community impact framework.
Yes,
What is
absolutely.
that, and how has it helped your organization shift their work?
Yes, absolutely. So, as the founder and CEO at Jenkins Public Health Consulting, in 2018, that's when we were established, and I knew quickly that organizations needed something that clearly wasn't cookie cutter for everyone. And so, with this framework, we've been able to match it to their existing programs, partnerships, and initiatives in the community to help enhance them. So, this 5 step framework actually strengthens their programs, their partnerships, and community relationships that not only attracts funding but sustains their program and organization for years to come. We know that nonprofits are closing at a high rate compared to for profit, but nonprofits are businesses, and we want them to kind of see how they are currently operating to improve their approach just like a business does. And so that 5 step framework has helped organizations survive when they were going to close in 30 days. We've helped them to stay open for years and they are still operating. We've helped organization uncover $25,000 lost per staff member, and more. So we are really proud of that framework, that has helped health focused organizations thrive throughout the years.
And considering that context and knowing the world and landscape that we're living in, as you say, a lot of nonprofits are probably are struggling right now, and a lot
Mm-hmm.
more of them are not going to make it through
Mm-hmm.
this climate.
This last
Like it's
quarter. Yeah.
right. It's sad to say, but it is the truth, and people are going to be
Mm-hmm.
suffering. But I guess taking it back to like your work, sometimes maybe like what are some of the critical things that you are seeing when you're working with organizations that maybe they can adjust to improve?
Mm-hmm. One of the critical things that I'm seeing is that they are using a lot of time on repetitive tasks that could be automated. And also, they're not looking at the overall outcomes other than like program outcomes, right? So, I've been working in public health and healthcare for over 15 years, designing local to national level programs and initiatives, writing grants, other funding sources. And there's a lot of repetitive tasks that can be automated that saves organizations time and money. And when we quantify the cost of ineffective activities or places where we can actually automate repetitive tasks, there's a massive, massive gap there and opportunity for growth and sustainability. The other thing is also tracking performance. So, data, right? And it doesn't have to be complex, it can be very simple things. They're not really looking at the numbers. They're just looking at what needs to be reported for their grant purposes or funding purposes, but they're not looking at actual performance in a way that's going to benefit the staff and the community or the operation of the organization. And so sometimes we're seeing organizations actually, I guess, capturing too much data that is not even necessary or that's not needed. And, ethically, you're only supposed to be collecting data that you're going to be actively using towards current initiatives or future initiatives. And so we talk about data minimization in our 5 step framework. And then also partnerships, right? The third thing I would say is partnerships. People say they have a lot of partnerships, right? I know a lot of people, I have a lot of connections, but when we take a deeper dive in it using our approach to partnerships, we see that they're actually not active, they're ineffective, they don't align, and they're not the organization themselves. They're pulling all the weight that the partner is actually supposed to be helping with. So we actually strengthen partnerships as well. And we see that without it, there's a huge gap in loss of opportunities.
I appreciate you lifting that up and sharing
Yeah,
those examples, and I can definitely
absolutely.
see those as tangible ways to support and understand what you can do to make maybe somewhat of an impact in your organization at the time. Are
Absolutely.
there like specific type of or size of health focused nonprofits that you typically work with?
No, not really. And we work with for-profit and nonprofit organizations. I like to say health focused because that kind of groups everyone in. But there's not
Hmm.
typically a size. We've worked with multiple national level health organizations, and we've also supported startups. nonprofit and for-profit health organizations. Typically, startups we don't, usually work with, but most of the time we are kind of in the middle of the startup to the national level health organizations. So organizations who have staff, we do have some independent founders and CEOs as well, who are running their companies by themselves. But majority of the time, they do have teams of hundreds or thousands of staff.
And then considering that you have worked as you say, national organizations and local organizations, how do
Yeah.
you tailor your strategies to those different contexts?
Yeah, tailoring your approach when consulting for health organization or even coaching individuals, assessments are they have to happen, right? Because then I would blindly be supporting their goals or their initiatives without knowing what they've done first or what they attempted to do and what were those outcomes. Because sometimes people don't just hire a consultant to start something new or to get this quick win, but they're trying to see, hey, we've done this, we see a little bit of success here, how can we amplify this? So we come in and we help organizations amplify a lot of the work that they're already doing, to have a long-term sustainable impact, again, to bring in revenue for the organization, which directly benefits the community, because that's why we're doing a lot of the work that we're doing, right? We have these programs to benefit the community, or having these community outreach events to benefit the community, but we help them with their approach, right? How do we make this community outreach and engagement event, or initiative more transformative in a way that you're actually getting an increase in program participants for your programs. You're not just there for 8 hours at a table doing nothing. You're actually having some goal driven things that align with your organization.
And with Jenkins Public Health Consulting, how do you all approach sustainability and impact when you're doing your consulting work?
Yeah, sustainability and impact is big. I would say from the start, when I'm working with a client, I'm already thinking about the end, right? So, how are we sustaining them beyond what they've hired me for? So, for example, we're working with the pharmacy. One of the clients that I never thought I would actually work with because of my own biases and beliefs around pharmaceuticals, right? Thinking that they were all bad. But once I got into it and realized, hey, this organization is actually for the community and they're doing good for the community, I realized that they had so much more potential than I initially even thought I could help them with. So we designed several programs that were fully funded over the past few years and continue to stay funded. And now we're creating online courses for those programs that have become highly successful and well known in their communities. So that's sustainability, right? So not just creating programs and not just getting funded for a period of time, but we're helping them set up processes to be funded for years to come through their own revenue source of online courses, right? And so even with a non-government organization or a government organization, that is possible for them. And we hope that more organizations lean into, using automation and online course development, or strengthening your approach if your courses aren't performing at the rate that you would like. So, the repetitive task is one too, automating where we can, using technology to our advantage without getting too techy, because there are some simple things to make things a lot easier and stress free.
Yeah, yeah, absolutely. I could only imagine. It's like not trying to come in too heavy handed, because I know like sometimes it could just be like a Excel sheet and like a SOP of like how to do something that is really needed to improve something, as
Yeah,
opposed
yeah.
to bringing in like an entire CRM or something like that.
Right. And we do see a lot of the times, most of them don't have a CRM, which is different from a project management tool, right? So the CRM, you're really collecting the emails, the phone number, the information to communicate with them. But the project management tool is definitely something that you need, I would say, almost as equal or more than the CRM. Like, you need a project management tool if you have multiple people working or supporting your organization, even if you are a solopreneur, so that you can track your outcomes and see, hey, what have we done? What's coming up next? Who is responsible? How much is this costing? So much around that topic for sure. So CRMs and project management tools are different, but they are both necessary.
Well, I appreciate you raising that too. And shifting a little bit here.
Yeah.
So you've done a lot of work in chronic disease and community engagement, as we'll learn about a little bit later on. Why
Hmm.
is chronic disease prevention so important to you?
Chronic disease prevention is super important to me, and it's a very big passion of mine, because it stuck out and it led to a career change for me. Actually, when I was in college pursuing a career as a surgeon, which was actually a part of our first interview together, I talked about my journey to becoming a pediatric surgeon and how that shifted for me when I worked in a hospital setting and noticed that patients were there for preventable things, and just serious chronic conditions. So diabetes, seeing amputations, seeing even young people dealing with chronic conditions. A 30-year-old guy having, heart conditions due to chronic use of smoking, chronic smoking, right? There was so many things. So chronic disease is a passion of mine that started very early in my career. And I see the rates of heart disease across the nation. I see that 6 out of 10 people have at least one chronic disease that they're aware of. And so it's a big passion and it's a big need. And I know that the work that we're doing at Jenkins Public Health Consulting has changed the health outcomes of communities in multiple states in the United States and beyond.
And what are some of the challenges that you see in doing this work around addressing chronic disease?
Some of the challenges that I see is that, sometimes staff and leadership they are stuck in the process in which they've, you know, affected change, right? Change is hard. And until we start uncovering the gaps and the opportunities that exist when they make small tweaks to their existing efforts, then that's when they become more open. But
Hmm.
there's people who think that everyone should know this by now, and that we do market, so why do we have to keep marketing? But it's like 1% of your audience on social media actually sees your content, and so there's just better ways to go about organic marketing. So we do talk about paid ads, and you have to be ready for that. So we don't always just directly recommend that. We want to make sure our clients are set up for success, but there's just better ways to amplify your impact as an organization.
Yeah, that makes sense. And I feel like chronic disease, when you think about chronic disease, it's like lifestyle diseases. And
Mm-hmm.
oftentimes it's the system and the built environment and all those
Yeah.
things that are around you. And those things are challenging. So
Yeah.
fighting against that takes a lot of work.
Yeah, and I'll add another thing. I've been working with a lot of healthcare organizations over the last
Hmm.
few years, more than even just public health, right? So public health is prevention, healthcare is more treatment side. And with working with a lot of health IT and pharmaceuticals and other healthcare spaces, I noticed they don't have the public health background or
Hmm.
expertise to really make that program or their goal more effective. And so we're seeing a lot of great ideas that are sitting, or they're not actually creating impact. And so the collaboration between healthcare and public health, it definitely needs to be increased when they're trying to design programs and sustain these programs. I had a client who didn't know what to do next because the grant was removed, or the grant was dissolved basically. And we helped them figure out what that looks like and why, and how, as a certified health education specialist myself, we were, it just made so much more sense for them. We were able to help them design an effective program that lasted.
That makes a lot of sense. And you
Mm-hmm.
you touched on it a little bit, so I don't want to forget it. You touched on the shift of you wanting to become a pediatric surgeon, and then kind of learning about chronic diseases made you shift
Mm.
in. What are some insights looking back on that change or that leaning that you want to share with us?
Yeah. The shift between then and now is like, I'm glad I did it. I'm glad I did it, and I didn't listen to my parents. Like they say, listen to your parents. I love them dearly, but I'm happy that I stuck with what was in my heart and not what seemed financially, for me upfront, right? Because could have got paid upfront faster than the route that I initially took. Because I had to do a little bit more schooling because my whole career changed, right? But
Hmm.
now, today, I am so grateful for the work that I do. Every day I wake up excited, and I'm grateful for the flexibility being a business owner that it provides to me and my family. And I do have a child now. Since our last episode together, I didn't have a child in 2019. So I do have a 3-year old and just a very active family. And so, yeah.
And what's it like being a mompreneur?
Being a mompreneur is it's unique. I don't even know what word I can put to that. It's very unique. 9 times out of 10, my daughter, she's pretty chill, but if I invite her to get on camera, she's gonna take over. But like the balance of mom and business and wife and business as well, I think there's boundaries. I don't believe in balance because sometimes the balance is just off, and
Mhm.
that could be every day of the week or just several days of the week. I believe in boundaries. So a lot of the times I'm not taking calls or certain things around my family, but I do set business time for business when they're asleep or when they're away. But it also opens up more opportunity for me as a business owner as well because that's another subgroup of business. Networking opportunities. And it also shows my daughter that, hey, there's more than 9 to 5, even though I believe heavily in the 9 to 5 because it helped me to get my business where I am today. And that it's not for everyone. So it shows her that there takes dedication on both sides and that success can look how you want it to look as a woman.
Awesome, awesome. And I didn't say, but congratulations on, on the baby since we
Yeah,
chatted.
3 year congratulations.
Yeah, yeah, that's awesome. So shifting once again, you kind of mentioned like executive coaching and some of the
Hmm.
work that you do. So like on the mentorship and workforce development side, you
Hmm.
run a mentorship program. What
Yes.
gaps did you see that made you want to launch this?
Yeah. So I launched the public health mentor program in 2019. I had been doing a little bit of coaching in prior to that. But when I started Jenkins Public Health Consulting in 2018, I was still supporting health organizations, training founders and CEOs, and helping organizations just stay open, get funded, be successful. And in doing that, I was able to uncover the skills that they're looking for and the expectations that people should have when they're entering the workforce or transitioning into a new job and understanding the role versus the skill versus just the different layers of the onion that's required to understand about navigating the workforce as a whole, no matter if you have a little bit of experience or a lot of experience. And I also noticed that people have this expectation of thinking they need all the degrees, all the certifications. And I was really able to change that perspective of those who went through our program and they still had a lot of great outcomes, from unemployed to becoming an epidemiologist, right? They were unemployed for 2 years. Someone was a fellow, became a senior level analyst, in 60 days. So there's a lot of successes around the approach for sure.
I'm glad to hear that. And I do think a lot of like mentorship, coaching, and
Yeah.
the support that people need is in breaking a lot of those like limiting beliefs or false
Yeah.
stories that you
Yeah.
kind of continue to tell yourself. And
Yeah.
I'm
Yeah.
glad that you found a method to do that.
Absolutely. I would say, the mindset thing is a huge issue. I
Hmm.
would say 90% of the time, those who we served through our program, it was a mindset issue. It wasn't a skill issue. Even though they're building 30 skills in our program, but the mindset thing is the thing that's going to get them into the next opportunity. That's going to get them into the higher pay, right? You can have all the skills, you can have all the resources, but if you don't have the mindset and the confidence, it's going to delay opportunity or limit opportunity significantly. So mindset is huge for sure. Also, like, getting outside of your circle of influence sometimes will change the game for your career because we think what's not available because of what's not available to your circle, right? So some of these groups that people are in and everyone needs a job and everyone's getting, fired, you got to get out of there. You got to get out of there. I know it's a community of people, but the community is all suffering from the same thing. And then you become that. You think that's all that's available. And so, someone as myself who's actually training founders, CEOs, and health organizations, I see the millions of job openings. I see the budgets that are in the multi millions that they have to pay people. And so, we bring those insights to people who are looking for jobs or wanting a higher pay.
And you've done this since 2019, I think you said.
Yes.
What have you learned from mentoring others in public health?
The thing that I've learned from mentoring others in public health is that everyone has a unique desire for their own career path that they might not even believe exists, but it does.
Hmm.
So when people think they only have to go this route, we open up the floodgates of opportunity to say, hey, like, do you know, like, Amazon is actually hiring like health professionals. FedEx, I think, put out a role for a health professional, that you don't have to work in government, and to break those beliefs, just helping people uncover like different things. Like, there's less government agencies than there is non-government agencies. So there's so many jobs available, in that everything doesn't ride on that opportunity for you to work in a government agency. So it's taught me to be creative in my approach in telling them what's available to them, and how you don't have to go down the same route that most people go, which is a traditional route, to seeking jobs. It's also taught me, like, just to be an active listener. I believe I've had the most success with relationship building and trust, and also success for them because I actively listen versus trying to give them a solution right up front to their goals. Listening, and really then helping them to talk through their own challenges, because sometimes delaying action is what the issue truly is, versus the opportunity to get there, right? Like, you have the tools and the resources, but are you taking the action, and why not? So active listening has taught me a lot about myself, and the people that I support.
And what does public health mean to you?
Public health means to me, it, it's a grand topic. Public health is everything, um, everything around us. Public health means the food, the air, the sidewalks we walk on, the technology we use. Right, it's all around us, and public health, personally, to me, is really my calling.
Love it. And now shifting to your academic pathway, and I will let everyone know that I will link your former episode
Okay.
below or in the show notes, so that people can check that out as
Yeah.
well. But what you went to Indiana State University for nursing. You got your bachelor's at Ball State University in public health science and interpersonal relations.
Yeah.
Give us an overview of kind of like your academic pathway, and
Yeah.
you kind of shared a little bit more about it earlier, but give us
Yeah.
that broad overview.
Yeah, no problem. Yeah, I went to Indiana State University in Indiana initially. Was on track to get into their nursing program, but their school had some issues with their nursing accreditation. So I switched to Ball State. And that's where I had this aha moment in my career to actually change from becoming a surgeon to working in public health, because public health wasn't even introduced to me until I went to Ball State University. Everything was about medicine and nursing and so forth before then. And it's really just been an incredible like experience, and looking back, like, a lot of things I had to go through to realize that this is still the best career decision I made for myself, and I don't have any regrets.
I'm glad that you have no regrets, and it sounds like things are going very well as well. Feeling very fulfilled and being able to support a lot of the work that you ideally want to do, which I think is awesome to hear about.
Yeah.
And kind of want to go on like that journey
Yeah.
from I guess understanding that you wanted to go in public health
Mm-hmm.
to then becoming CEO of Jenkins Public
Yeah.
Health Consulting.
And I can give you
So,
And I can
mhm.
go a little bit deeper for you on that. After I
Oh,
graduated Ball
please.
State, um, thank God for connections, right? I felt very passionate
Hmm.
about finding an internship during college that was meaningful for me before I even cared about how it was meaningful for the organization. So I was very detailed in my search for an internship. And we actually have like an internship roadmap to help people with the same thing who need an internship. But I interned with the local health department, and I actually ask them for opportunities for me to challenge myself and learn and expand my ideas versus staying in one department of that health department. And it really opened up what career opportunities were available before I actually stepped foot into a paid, well, I was getting paid in public health before I graduated college, but a postgraduate job. And so thanks to those relationships and those experiences, I landed a job as an environmental health specialist right after college. And it really was a fun job, enforcing local codes and law to people who've been, operating pools and gyms for decades. I I enjoyed laying the law down a little bit too much, but it was also for the benefit of the public's health and safety. So inspecting over 500 pools a month, preventing drownings, preventing injuries around pools, enforcing, um, you know, uh, staff and leadership to know about CPR and lifeguards and when it's appropriate, when it's not, etc. So many different things. And then I became a community health screener for vision and hearing screening. Also did chronic disease prevention programming, where I designed a lot of community-based programs around all different types of chronic disease, heart disease, nutrition, smoking, diabetes, so many different, I think it was about 7 different areas of chronic diseases. And then I became a director at a medical center at Vanderbilt Medical Center, working with poison control, which was so fun, so cool. And so I did a lot of data analysis, data visualization, program design, statewide, national level initiatives there, and had between those times in my career, I had started Jenkins Public Health. I think about 3 years before I actually left corporate, 3 or 4 years before I left corporate, I started Jenkins Public Health, and that was a pivotal moment for my life of courage and understanding that you don't have to actually have money to start a business. There's a lot of different types of money to leverage, and so yeah, it turned out.
Okay, I appreciate that. We'll hold the courage, and I'll come back to that. I want
Yeah.
a couple questions. I'm also on the side of things like you. Like when I got into my internship, like I was like, yeah, give me all the things. Like I want to be busy all the time. I want to be involved in all the different kinds of work, and to my benefit, it allowed me to get involved in the community health needs assessment, which
Mm-hmm.
allowed me to get into the fellowship that I was able to get into. So I
Yeah.
think like being someone that kind of like ask for more and showing up and doing that is really important. But maybe someone is listening to this and they're trying to get an internship, and when they get that internship they're trying to make that impactful. What would you tell that person?
Yeah, I would tell them just to keep asking, but also make sure you can handle it, right? Don't ask for stuff that you're not going to be able to follow through on, but
Mm,
challenge yourself and ask them questions about their career journey. Get introduced to other people in the field, even if you don't think it's going to be worth it later. The person who my internship supervisor, and I can't remember what year at this point, my internship supervisor introduced me to this one guy, and a year later, he gave me my first job because he remembered my face. He didn't remember what I did as an intern, and it was actually at a conference. But that was the person who gave me my first job post graduation as an environmental health specialist. And so get introduced to everybody. Try to remember, try to take notes. If you can document their name and email and where you met them, like you just never know down the line how it will benefit you or how you can help them.
absolutely. Plus one
Yeah.
to that.
Yeah.
I like that. Like get introduced to people, and
Hmm.
especially as an intern, I feel like people are always wanting to give you those opportunities to
Yeah.
be in rooms, and people always want to give their knowledge and experience and wisdom and
Yeah.
opportunity to people that kind of go after it. So
Hmm. Yeah.
definitely appreciate that.
Yeah, I would
And
say too
and
that
mhm,
your personality is not an excuse for your opportunities. So
mhm.
me, I'm very outgoing. I don't mind meeting a stranger. Like nothing really scares me. I do have still a little stage fright, but someone who isn't very outgoing, it you still can network and get to know people in your own way, because nothing really is going to be handed to you that's worth having. Maybe a few things, but not a lot of things. And so you have to use your own will and determination to put yourself out there to get where you want to go.
Absolutely. Plus one to that, especially in
Yeah.
this environment, is like build
Mm-hmm.
those networks, build those connections, build those allies that can help you
Yeah.
get to that next step or get that interview or whatever that next outcome you need. So
Absolutely.
appreciate that. And then going into like your first role as an environmental health specialist, I don't know how did you do a lot of that in your internship, or how did you build the skill sets
Mm-hmm.
to go monitor pools and do these types of things?
Yeah. So it's interesting. The place that I interned, the health department that I interned with, they didn't have that service. So every health department is
Hmm.
different. It doesn't matter if it's in the same state, those health department resources and service offerings are different. So where I interned did not do pool inspections per se. But where I had my first job, they did. And so I was able to gain skills, and I passed a national certification to become a certified pool operator, which allowed me to understand pool codes, all these different codes and laws for the state of Alabama. I'm sorry, the state of Indiana. And so I gained those skills kind of on the job, and even previously, because I had understanding of the health department. I knew where to go to file certain things, and so some of the experience benefit for sure. But I did have to go through some training to become certified in that role, and the company paid for all of that. The health department, which
Okay.
is a government agency, they paid for all of that.
Okay. Well, I appreciate you. That helps me and gives me clarity.
Hmm.
And I'm also thinking like through that role up to your role as director in Vanderbilt University Medical Center, how do you continue to build the skills and equip yourself to really like succeed and to become a director at a medical center?
Yeah, that was my grace of God and the power of still not even networking, but making sure you're getting experience beyond your job. And so I say that to say that I was volunteering outside of school. I was volunteering outside of work. I wasn't just going to work. And I was also documenting the successes that I brought to the team, the successes that I brought to the community or the organization that I worked for. And I leveraged those things during my interview, which, I didn't even have what they asked for me to be a director. I didn't have a master's degree to be a director at a medical center, but I had the experience and I had the drive and the confidence and I had the receipts because I, was bringing in money for other organizations prior to. And I think that was one of their biggest things, to be sustainable and have someone who had experience writing grants. And so, I was able to bring that on and did so many more things throughout that. But, I say to someone who's looking to gain experience that they can leverage in a higher paying role or a new job, volunteer, go help an organization who needs help with their data. You can be that person who cleans up their data and they will see an improvement, right? Go help an organization with the skill that you want to build, volunteer with that, and then you can use that as an opportunity to get paid for it as well. So there's a couple ways to go about it. That's just one unique way that helped me do it, because I was writing grants for the American Red Cross. We won the grants. It was about poison prevention. I leveraged that during my interview, and I got the job after one interview, one resume, and it was a 50% raise in salary. So it was awesome.
Mm. That definitely is awesome, and yeah, appreciate you giving that insight as well. And um, I hear this often, like from people, and I love your take on it. A lot of people, people with bachelor's degrees or people that don't have master's degrees, they feel limited
Hmm.
in the job outlook, or maybe like thinking that they don't fit for these roles.
Hmm.
Considering that you do not have a master's degree, what kind of insight or advice would you give to that person?
Yeah, I think, what you have already ingrained inside of you is what I kind of talk about a lot, is sometimes enough. And I think if you just put in the application and make it clear and be detailed in your approach, you will get considered for that job. I say it's possible because it happened to me, and I know a lot of people who've been through my mentorship program who I coach. They've had a lot more experience than I do, but their limiting beliefs has led them to be stuck where they are. There's people who have multiple degrees and all the degrees and all the certifications, but they're still unemployed or underpaid. And so I help them leverage those things, right? Confidence is number one, but also, you know, understanding that your bachelor's degree does not mean you can't get paid as much or even more than someone with a master's or a PhD. Like I know people with PhDs who are like, "Hey, I'm only an assistant. How do I get out of this?" And there's ways. There's simple ways. And I think a structured approach to help you get from where you are now to where you want to be is always helpful.
Appreciate you sharing that,
Yeah.
and you all take that advice, because I definitely think there's a lot in what you just said there, in
Yeah.
the last two questions. I feel like
Yeah.
and be able to like empower yourself and find ways to show and validate that you are
Hmm.
valuable to all the different stakeholders and to all the
Yeah.
different outcomes that you're doing. And I love what you shared before, volunteer. There are so many different nonprofits or
Hmm.
just organizations out there that could do with a lot of help with
Yes.
from people with a public health background, public health lens, and that helps both you and them. And
Mm-hmm.
to your point, it could be something that you work to get paid for in the future. So
Yes,
don't
absolutely.
discount that.
Yeah, and nonprofits, a lot of people think like nonprofits, they don't want to work for them because they're broke or they don't make a lot of money. Yeah, nonprofits make like their budgets can be in the multi-million. It's not that they make
Oh
this
yeah.
much, but they get funded at that level, right? And so it is still good to work for nonprofit organizations. It is even a little bit more sustainable and stable to work for nonprofit, non-government organizations, because even with the hiring freeze and the government shutdown, they are still hiring. They are still paying. The checks are still being deposited. So if you're looking for a job, it's okay to look for nonprofit jobs, but it's also okay to look for health focused for profit jobs. And so it's out there. They need you. It costs them money every day to not have you in their company. I know this as a CEO of my own company that it costs to not have staff. But yeah, it's out there.
And then coming back to courage, as we were talking about earlier, you said that you started Jenkins Public Health Consulting and you continued on working in your career for 3 years. Tell us about that moment of courage, maybe to start Jenkins Public Health Consulting,
Hmm.
and then what was your vision? Did you envision 3 years and then I'm going to do this full time, or
Hmm.
how did all that plan out in your mind?
Yeah. When I started Jenkins Public Health Consulting while working for a government organization, I didn't have a plan of how long I was going to do both. I just knew that I
Okay.
could bring in some, additional income and that I could really help, design some more programs. And I love designing programs or strengthening the design and really helping them show impact. So I was doing that as a side for a little bit. But, the moment that I had the courage to step out was when I had my baby, because it just didn't work the same. It just didn't. And I wanted to be there for my child in a way that my family didn't have a chance to be there for me. And it meant a lot. And it also took a lot of courage because, when you're working for an organization, that's, unless you're showing until, excuse me, as long as you're showing up for your job, you're going to get paid for your job, right? And when you're a founder startup company and you're still learning all the reins, some months it can be different, right? But I knew that it was time to walk away because I knew I could make more money than I was getting paid. Even though I was getting paid really well, I could still make more money and I could make my own schedule. And I made the rules and I didn't have to say, didn't have to explain why to anyone. So it was beneficial for myself and it took a lot of courage because I knew I was stepping away from something that was consistent to something that could be a little inconsistent, but now we have our thing, we have our engine rolling. I'm not really good at analogies, but things are going well.
What helped you to get to that point where everything is working well? What are the things that you've done to get to that point?
Hmm. Yeah, I think telling people more about what I do to give me more experiences of dealing with different projects and clients, because even if it's an
Mm.
organization with a similar program, they have different needs and a different approach. And so that helped me to get down my process and really strengthen our framework, our 5 step community impact framework that works for every organization, but of course it's tailored to their unique needs. So some companies don't use our entire framework, some only focus on building capacity. But at the end of the day, they end up needing all of it because there's just some areas where you need to strengthen the impact to benefit the other part of it. So, like marketing effectively and impacting communities, those kind of go hand in hand because marketing online and in person is not just putting out the information, it's making sure people take action on it, right? First of all, understand it and take action on it, right? So we were able to uncover our process. It's helped us know every day what to expect in our business. And it's also helped our clients really grow and maintain their efforts and the community to be proud of what they're doing without me saying anything. I don't take any accolades for that. So that's helped us a lot.
What does a day in your life look like as CEO?
A day in the life of a CEO. I've thought about posting this on social media, but I'm kind of private more than it may seem. But a day in the life of us is really getting my daughter up and figuring out an activity because our day-to-day has changed a little bit over the last 2 weeks since we just moved across country to Phoenix. but really getting her up, getting her day started. My 3-year-old, we try to do her homework until we get her into a new Montessori school. And then we're checking emails and talking to our marketing and operations specialist about, the people who are showing interest in our services, what's happening next for them. Do we need to send them a proposal? Do we need to onboard them? A lot of the times I am doing a lot of interviews for media. So whether it's podcasts or newspaper interviews, I'm checking in on our clients to make sure that all their needs are met and that they have goals set for each week. So with my clients, I typically am checking in on their goals, not just the work that they've hired me to do, but I'm making sure they're progressing. And around 5 o'clock or so, I'm typically shutting things down to make sure that my family has their dinner. And after they go to bed, I pretty much kind of log in and do some admin work. So I do my high performing task in the morning, like calling potential clients, following up on messages, etc. And then I'm working on projects throughout the day that didn't really need to be done by my staff, but needed to be done by me. But I'm making sure we're bringing in new clients on a weekly basis, or however I need or desire to bring in new clients, by handling those tasks in the morning, and then the the low impact tasks in the evening.
And what's most rewarding and most challenging part of the work?
The most rewarding part is getting to know a lot of different types of people. Like every single person is different in this world. And so the different personalities, the different needs, the different ways that they're talking about public health, the different understanding of like partnerships. Someone asked me, what do I mean by partnerships? And I was kind of surprised because they've been, the CEO of a health organization, but they only had one grant for the last 15 years. And so a partner was that one grant. It wasn't about relationships of diverse groups of people and organizations. And that's what partnerships are. Um, Say that question again for me. Sorry.
Most rewarding, most challenging.
Yeah. So the rewarding part is to meet all these new people and diverse perspective and needs, and approaches to things. The challenging part, I would say, is I would say a little AI. I'll be transparent. AI has been a
Mm.
little challenging because some of our clients who are wanting to integrate AI, they aren't ready yet. They have to strengthen their processes first before you just start doing stuff. And everyone wants to jump on the bandwagon and just use it. But we have confidentiality, we have HIPAA, we also have a cost, so we want them to sometimes take a couple steps back before they use the AI. And so that's been a little challenging for the last, I would say, year, with our clientele wanting to just jump into AI without having the protections in place, because sometimes they think since they're not a hospital or that they're not a government agency that they don't have to have the same protections in place. And they
Mhm.
do. And also like leaking your intellectual property, they're not thinking of those things. So I would say that's been challenging as someone who is a trademark company who has copyrighted materials, who understands intellectual property and so forth. When AI is brought into the mix, sometimes that can leak your data, beyond what you might expect. So the can be the challenge.
No, that's real. That's real, and I can imagine that's a ever growing conversation that's
Hmm.
happening.
Yes, yeah. But I tell everyone to embrace it, and there's opportunities to use it where needed.
What's some advice you'd give to someone thinking about starting their own public health consultancy?
The advice that I would give is just go ahead and start it. Become legal first. Like I said, I started consulting and coaching people even before 2018, but I wasn't a legal business. Um, and so I would say if you want to start a business, you can go ahead and get that business started. Get your business registered as a business, get your business license, and get business funding to cover any costs that you need: laptops, software, computers, etc. And just go reach out to the past people that you've interacted with, right? All of the employers that I worked for in the past, they have already been my client. And so that shows that relationships matter, and the way that you leave also matter. And so I just say do it. I didn't have a reason why not to, or a reason to start Jenkins Public Health, other than wanting to expand my skill set. And you should just do it, even if it's money that you want to make more of.
I appreciate that
Yeah,
and definitely agree. There's so much opportunity out there and so much work that needs to be done. So if
absolutely.
that's in your calling, find your way to do that.
Absolutely. And, you know, it's hard. It takes consistency. It takes knowing that, you know, there's ebbs to flow in working for not someone 9 to 5, and there's ebbs to flows of working for yourself. But you get to choose, right, how you show up. And so if you actually play full out, your results will show. If you're holding back even in the slightest, it will show. Even if you're still getting results, it will show, even if you're holding back. So you have to know what you're holding back from, and if that's limiting your opportunity as a business owner.
And we're about to close out on past week guest question and the Furious Five. Was there
Hmm.
anything I didn't ask you or something that you wanted to share?
No, it's just been a pleasure talking about this and how, you know, a lot of people have a certain understanding of public health and healthcare, but understanding that the job opportunities are so much more broader than what we are
Hmm.
experiencing right now. You know, what they're showing on the news and what's in your inbox, there's just so much more opportunity for business owners and those who are job seekers to work for organizations.
And taking us to the past week's guest question, what has been the most unexpected lesson you've learned in your public health career, and how has it shaped the way you approach your work today?
Yes. The most important lesson that I learned about so far in my career, and I would say as a business owner who collaborates with my competitors and my those who are not competitors, is understanding intellectual property and how
Mm.
valuable it is. You know, I think a lot of times people are starting businesses without like contracts written by an attorney, and that you understand as the person who is sending these contracts and how to protect your intellectual property that can be intentionally or unintentionally shared, with or without your knowledge. So that is one thing for me, is the intellectual property.
And now shifting to the Furious Five, the five questions that I ask all guests.
Hmm.
Number one, what advice would you give to a student trying to pursue a career in public health?
The advice that I would give to someone who is pursuing a career in public health, I would say to the college student who's trying to pursue a career in public health, volunteer in the community, not just on campus. It will change the opportunities for you. Be intentional about your internship location, and do it in person if you absolutely can. Unless you literally cannot do it in person, do your internship in person. It will give you a higher level of the skill that you're trying to learn or gain. It will give you a deeper understanding of that, and it will also lead to more people and opportunities for your career post graduation.
Number two, and you may have answered this already, but if you're talking to someone wanting to get into your position, what advice would you give them?
Someone who's trying to get into my position, the advice that I would give them, um, that's a hard one. Let me think on that. Make the ask. If you're a business owner, you're in my position. Don't be afraid to ask for the sale. I would say the most challenging part of being a business owner is knowing how to sell. Because I'm a public health professional. I'm not a salesperson, right? And so that was a challenge, but it's not about knowing how to sell. It's about asking to for them to work with you. It's like, hey, we can help you with this. This is my experience. This is my client's results. Ask for the sell, and more people will say yes, versus you just assuming that they will say yes because you were present. So I would say that.
Number three, what's something you're working on improving in your life right now?
The one thing that I'm improving in my life right now is sleep. I am naturally a night owl, and I just enjoy being up when everyone's asleep for some reason. And so I'm working on the not even the number of hours per sleep, but just the quality of my sleep. Because late owl, late snacks, early mornings, usually because I have a 3-year-old busy baby girl. And so, that could affect the overall quality. So I am working on improving the quality of my sleep.
And number 4, professionally, do you recommend anything?
Professionally, yes. I recommend having a LinkedIn. Any professional, no matter if you're unemployed, been employed, happy where you are in your career, you should have a LinkedIn. It's the number one platform that is specifically for professionals. More than 70% of hiring managers are on LinkedIn. LinkedIn is beyond just getting a job, it's about if you want to be a speaker, if you want to be interviewed like this on podcasts, even if you're working for organizations, you can find those opportunities on LinkedIn. Um, and just reading more books about leadership, even if you're not a leader by title, reading more books about leadership and how to navigate, how to walk, how to speak confidently as a leader. That's what I would recommend. There's tons of books out there. And the last thing I'll recommend that I always recommend to everyone, first of all, I always recommend LinkedIn. And then Toastmasters. Toastmasters changed
Hmm.
a lot of the things for me personally, the way that I speak, the confidence I have to speak, the environments in which I speak, and being able to be a keynote speaker for even some of my clients. And so I highly recommend Toastmasters. Your organization is likely to pay for it. And so, look in your area for a group on Toastmasters website.
Great tangible insights.
Thank you.
Um, Number 5, if there was one piece of advice you'd give to your younger self, what would that be?
One piece of advice that I would give to my younger self is spend the money. I can be a little bit um I would say I spend money that I feel like is necessary to spend, but I need to have all of it needs to make sense. The ROI has to be there. I have to see that. But sometimes you can't always see that until afterwards or until once you take that step and then you realize, hey, you should have did this a long time ago. It was worth spending, investing in to grow your business, to grow your mindset, to get access to whatever. I would have done that sooner, right? I would have hired a business coach way sooner in business to help me grow to where I am and beyond today. And so sometimes it's like, go ahead and just spend that little bit. Your return on investment will be 2 to 10 times more, and you won't regret it. If anything, you regret not spending the money. So that's what I would say to my younger self.
Well, thank you, Brittany.
Yeah.
Thank you for that answer and just the conversation today. It was really good to catch up with you.
Yes,
Wishing
absolutely.
you a lot of luck and success out in Phoenix, and I
Thank
hope that
you.
you enjoy it out there. But it's been a pleasure chatting with you.
Thank you so much for having me.
It truly, truly is my pleasure. I appreciate you taking time for sharing your story with me again. And I look forward to connecting in the next few years on the podcast. We'll stay
Right.
connected in person
Yes,
more frequently than that.
absolutely. Thank you so much.
Awesome. Housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe, like, leave a review, and share this with a friend. Greatly help the show get out to more people. Hope you'll have a good rest of your day and see you all next week. Peace, everyone.